Let's talk about the risks of a vasectomy. A vasectomy is an effective method of permanent birth control for men who are satisfied with their fertility. It is a simple 10-minute procedure performed in a doctor's office under local anesthesia, and it causes no changes in the sexual function or sexual performance of the individual. Naturally, as any other surgical procedure, there are some potential risks associated. Let's just talk about them. Bleeding, known as a hematoma, can occur during or after a vasectomy, but it is less common with a no-scalpel technique. Hematomas may happen in 0.1 to 2.1% of men undergoing no-scalpel procedures compared to 0.3 to 10.7% for scalpel technique. If this happens within the scrotum, drainage of a scrotal hematoma, which is a blood clot in a hospital operating room, may be necessary, but this is extremely rare. Smaller hematomas do not require surgical drainage, but tender swelling can last for 2 to 8 weeks. Both large and small hematomas are very rare. If the scrotal skin bleeds at the vasectomy access site, the scrotum can become discolored, more like a black and blue skin appearance, for about a week. This discoloration is more common than swelling, but is actually painless. Infection is also a rare complication. Mild infections, that is swelling unresponsive to anti-inflammatory medications, will respond to oral antibiotics. It is actually rare to require drainage of infected areas. Studies comparing no-scalpel techniques with conventional techniques demonstrate lower wound infection rates for no-scalpel vasectomies at 0.2 to 0.9% versus 1.3 to 4% for a traditional scalpel technique. A sperm granuloma is a pea-sized, sometimes tender lump on the vas tube at the vasectomy site, but it almost never requires treatment. They actually may increase the likelihood of success with a vasectomy reversal if that is something that is desired in the future. Periodic tenderness usually responds to an anti-inflammatory medication like ibuprofen or naproxen. Congestion, which is a tender buildup of sperm and white blood cells upstream from or at the vasectomy site, can occur anytime after vasectomy, but usually goes away with the use of an anti-inflammatory medication such as naproxen or ibuprofen. Less than 1% of patients may experience chronic post-vasectomy discomfort, or PVPS, or post-vasectomy pain syndrome, that is severe enough that they will seek vasectomy reversal or division of the nerves coming from the testes. Recanalization, or failure, is what happens when there's the development of a channel of sperm flow between the two cut ends of the vas tube. If this happens during the healing process that is early, the semen never becomes sperm-free until the vasectomy is repeated. If recanalization happens months or years after a man's semen has been examined and declared sperm-free, we call that late. An unplanned pregnancy obviously could result, but the odds of this happening are far less after a vasectomy than the odds of pregnancy with any other form of birth control, including birth control pills and actually tubal ligation, which is the female permanent contraception. Failure depends on the technique used. The early failure rate is about 1 in 2,500 cases, and the late failure rate is 1 in 3,500 cases. The World Health Organization in the early 90s convened a meeting of international experts to review all research regarding vasectomy and prostate cancer. They concluded that there was no plausible biological mechanism for a relationship between vasectomy and prostate cancer. All available research data to date showed no causation associating vasectomy with prostate cancer, which is supported by the American Urological Association. Even though some studies have come up, it is clear that there is no causation associating both entities. These are the 5 things I want you to remember about the risks of a vasectomy. Bleeding and infection are very unusual risks. A sperm granuloma and congestion are managed with anti-inflammatories. Post-vasectomy pain syndrome is infrequent but can occur in a small proportion of men. Recanalization or failure is less than 0.5%. And finally, there are no medical conditions increased after a vasectomy.